Hi, my name is Louis Garcia. I'm the Director of Marketing at the BCCSA. We'd like to thank you all for making the effort this morning to join us for this event. I know it's early, however, we believe you will be well rewarded for your time. It was only a year ago that we met with employers in this same venue to share the research results of Blueprint for Action, which was a unique joint research project sponsored by us at the BC sponsored by the BC Construction Safety Association and undertaken by the Centre for Applied Research and Science at Simon Fraser University. One of the key findings of the report was that alcohol and substance use among construction workers was correlated with workplace-related accidents, injuries, and fatalities. But the study also revealed that continued employment reduced both alcohol and other drug-related risks, and that the work community played a critical role in the initiation and maintenance of recovery. We all recognize that there's a gap between the needs of workers facing both substance use issues and mental health challenges and the ability of healthcare system to address them. But construction employers may have underestimated the very important role that the continued employment they provide plays in supporting a journey of worker recovery. Today you'll hear presentations by two fascinating speakers united in their conviction that recovery-informed workplaces, work environments that destigmatize mental illness and substance use, can provide workers with support they need as they strive for wellness. First, you'll hear from Dr. Paul Farnan, a 30-year veteran in the field of addiction and occupational medicine. He's both a clinical associate professor, Department of Family Practice at the University of British Columbia, and adjunct professor, Faculty of Health Sciences at Simon Fraser University. A member of the Blueprint for Construction research team, Dr. Farnan will share his insights into the many ways in which workplaces can become catalysts for positive change and healing. But that's only the beginning. Listen as he explores the ripple effects of workplace support on overall employee and family well-being, work productivity, and retention in the construction industry. After that, you'll hear from Ian Robb, Chairman of the Building Trades of Alberta, as he highlights the achievements of BTA's unique Building Resiliency Program. Launched as a pilot in 2020, this successful program offers new options for workers and their families to claim a positive pathway as it addresses mental health, addiction, and dependency challenges with workplace support. The program champions early detection and prevention efforts that are non-judgmental, non-punitive, and encourage self-disclosure by workers who want help to address their mental health or substance use without repercussions. As a passionate advocate for recovery-informed workplaces, Ian demonstrates that workplaces which support and empower individuals to navigate these challenges inspire loyalty and productivity while leading to better health and safety outcomes. Our speakers aren't claiming that they've developed definitive solutions to these important issues, nor are they aiming to compete with the worthwhile efforts of so many individuals and agencies working to reverse the tide of mental health challenges, alcohol, and substance use. But listen carefully and see if their inspiring words can plant the seed of transformation in each of our workplaces. So Dr. Farnan, if you'd like to...
Thank you for the invitation to be here. Most important things is I'm Paul. I'm married to Mary Louise for a long time. We have 5 adult children, and I work in the space of addiction medicine and occupational medicine, which has intrigued me for 30 years. And I'm also a person living in long-term recovery. So when Mike was talking about this, this term is used in a lot of places around the world, not as much in Canada or in BC, but I intend to talk a bit about workplace, which you're very familiar with, and then maybe bring some of this recovery piece to it as well. I'm supposed to disclose and make sure I disclose when I do any presentation with my colleges. So I have received grants in the past from SFU, from University of Alberta, for research, for speaking honoraria for WorkSafe BC, the Recovery Conference of Canada, BCCSA. My work has primarily been in consulting with employers, unions, disability carriers, usually with complex people, complex cases of people with addiction, mental health issues, and it has been a great career, but it's often at the end of, it's more end stage or advanced than I would love it to be. I have no financial relationships with any treatment programs, cannabis industry, monitoring industry, or pharmacological entities, and I've practiced occupational medicine, addiction medicine for a long time. So this was when we spoke. We thought we'd try to break things up a little bit and maybe reflect. Some of you have the same colour hair as me, so you'll have gone through or experienced a lot of the same things in occupational medicine and maybe in addiction medicine. Just to reflect some of those things, where we've been and maybe where we're going. Changes that have happened in the substance use kind of world, especially internationally, and the recovery science and recovery research that goes on, not unfortunately in Canada and BC very much. Evolving challenges for workers, co-workers, families, and then wrapping up with this concept, this recovery ready, recovery informed, recovery friendly workplaces. These terms being used in a lot of other jurisdictions, but essentially looking at the same things. In occupational medicine, I'm around long enough that I've seen the, when we used to x-ray people for silicosis to see did they get it. Then we started saying, well, maybe we should do better things to try and prevent people getting it in early case finding and so forth. So I've seen that spectrum of moving more towards prevention, especially with physical illness. I've seen more disability management, as many of you had, helping people back to work who were off work and stuck, and we've seen return to work and stay at work initiatives from the American College of Occupational Medicine. And I've worked in industries where the CEO, has safety trumps production behind his desk, and I've worked in industries where that's true, and I've also worked with organizations where that was very much not true, which I didn't work for very long. So safety became a big issue, and then psychological safe workplace. I've done a lot of work mainly in healthcare and hospitals, and the craziness that goes on in our healthcare system, that it's really important to stand up and be able to have a culturally safe workplace. So we've seen that. And then the hidden disabilities go on and continue to go on. We're doing a better job, I think. Increasingly, all size employers are the value proposition for investing in their workers is becoming more obvious. And we hear more about mental health and well-being and people providing services and so forth. I think we're doing it better. I'm not always sure about how well we could do it better. And then we tag on, and addiction, but it's always a tag on. It's like we've something mental health and addiction. So that's probably my personal little resentment that I have to deal with, that it doesn't get the focus that I think it needs to get. I've been around a long time from the addiction perspective. When I graduated in Dublin in the early 80s, Dublin was the heroin capital of Europe. It was the easiest way to get drugs into the UK. And actually we had the IRA being vigilantes and helping deal with the drug dealers, only to find out there's a lot of money in drugs, so then they took over the industry for a while. And that was associated with a lot of HIV. So it was an interesting time. I've been around while we had China White heroin, really potent heroin, the 80s, lots of overdose deaths. I've been around for the crack cocaine epidemic, bigger in the United States, especially affecting men of color, powerfully rapid onset of the effect of cocaine. We've had crystal meth, and it's interesting, it doesn't get the legs here now, but certainly in our practice we're seeing more issues with crystal meth, and there's a newer crystal meth, P2P, there's a newer type of crystal meth that's more powerfully active on the mental health system and more psychosis and so forth. And then of course we had the prescribed opiate debacle with Purdue promoting and encouraging doctors, and approved by the FDA, to write oxycodone, which caused all kinds of chaos and took a lot of time to turn around. And as we turned that around, so to speak, but with de-prescribing, there was a lot of people stuck, and we sometimes think of the oxycodone as a first wave of opiates, and then the second wave was, the dealer said, well, it's hard to get these oxys now, but I can get you heroin, it's a really good deal. And so we had a second wave of heroin, and then that just wasn't enough, and then we have illicit illicit synthetic opiates like fentanyl and the analogs, causing the chaos that it causes. And I can't imagine we're in a room this size where someone, hasn't been significantly impacted with the current crisis in our province, in our country. And I hope what I say isn't too upsetting, but given today's focus, I didn't really have time to focus on this. However, we have this, opiate overdose, toxic drug, illicit. We have all these kind of names, but we've got this chaos going on of this supply of potent drugs that are killing a lot of people. 8 years into this, we've 14,500 people dead. We've, people talk about 6 deaths a day. And, I think I saw in April 2024, there were 182 deaths from toxic drug overdose, which was, a 24% decrease from the same month last year. We're under no illusion that this is suddenly, going away. This is chronic and ongoing, and it seems like all we have to offer at times or hear is, well, let's provide safe supply and let's do more naloxone kits. And these are important, and I don't want to get into too much of a debate about it, but I mean, safe supply sounds like just a great idea. It's like, I'd like safe water, I'd like safe antibiotics, I'd like safe drugs. But how it's rolled out for us on the ground is, it's just really complex. And, if our only solution as a province or as a community is naloxone kits, really important, but I just think we need more than that. And then I want to just reference a little bit about the construction sector. I want to reflect on this slide from my colleague Ray Baker, and really what that's trying to say is, in the past we had definitions of addiction, then we moved to, we used the DSM manual, many of you will be familiar with. We moved to substance use disorder, that it was either dependence or abuse, and then we moved again to substance use disorder, it's mild, moderate or severe. And in any month, these are probably average numbers of what goes on. Many people haven't consumed any addictive substance in the last month. Some have, don't have any problems, never have any problems. Others will have mild or moderate, and some will get very severe. And often the very severe situation is what we're listening to on the news or what we hear about. And it's tragic that people get up that far. I'm so into getting upstream or getting down into the lower levels. And in my office, people will be referred because they got up near the top, and there's all kinds of chaos going on for them and their families and work, and they're really sick. And others will ask, good morning, Paul. Others will ask in those lower stages, look, my employer is really good, and he or she said they'd help me, and I asked if I could come and speak to you. And they're great conversations to have where someone really wants to engage. So that's just, as an addiction medicine specialist, we're looking at this broad spectrum of stuff. And then, of course, the news and the media is much more focused on other things. Now, the human cost of addiction is huge. As I say, there's people in this room, I'm sure, know this as well as I do. But the financial cost is also significant. And the Canadian Substance Use Costs and Harms Organization, they put together numbers every so often. The last one's 2020. And remember, this is kind of pre-COVID, so it's worse, no doubt, when they do the next one. And what will I try to bring your attention to here? I guess 49 billion, significant amount. When they did it in 2014, it was 38 billion. So that equates to about $1,300 for every man, woman, and child in Canada. These bars here, noteworthy. The top two are alcohol and tobacco. 62% of costs, alcohol and tobacco. And how well do we do that? You notice the significant healthcare costs with these two drugs. And then we have cannabis, opiates, and all these other drugs here. The total of healthcare and criminal justice is just about the same as lost productivity. And that's what attracts economists who are thinking of the Canadian economy. They're up at this level, gross domestic product, production, and also industry leaders in various industries are thinking, we are losing a lot of production. over not addressing this properly. And if you look at the size of the bar in opiates, you know, compared to others, this is significant. So people we see who get a you know, untreated progressing addiction with opiates, they're often very much not able to hold down a job or go to work. They're certainly not able to complete safety sensitive work, especially in your sector. And even sometimes when they're treated, a lot of my colleagues in the addiction world, they've no lens for occupational medicine. So when I speak to them, I say, you've got this person on, you know, 6 medications and so forth, and you want them to go back, you know, you say he's okay to drive, you know, operate a crane or whatever. It's like, oh yeah, you know, maybe, yeah, do you think that's an issue? I didn't think of that, you know. So work, safe work, people who I speak to want to be on, you know, we all want to be on a safe work site, and we don't want to be second guessing whether the guy's going to drop some tools from 3 floors up. So cost significant. I just picked these out of the paper just in the last week or two. You know, I figured that announcement from Mr. Trudeau in the last 2 weeks. Then I suppose we must have built about 40,000 houses if we're on target to make this goal. And I jest, of course, but the labour shortage is significant. I enjoy working with a lot of different sectors. I have a son-in-law who works in construction, and his, you know, at his wedding a few years ago, I spoke with his boss, and his boss was saying, like, it's really hard to get good people. I want good people. I'm willing to pay them. I'm willing to do the extra. I want them for the long term. It's hard to get these people, and I think we're all concerned about the labour shortage moving forward, because construction is the backbone of modern infrastructure and responsible for all of the things that we need as society. So, you know, that concerns me as a Joe citizen. We read a lot about construction workers dying, as I say, in the opiate overdose, and I thought, or toxic drug crisis and so forth, I thought I should just reference something about that. So, you know, depending where you read, a third or a half of deceased men were working in the construction industry. So the narrative I think you get, and the worrying narrative, because I've spoken to a parent who says, well, I don't want my, you know, my son wants to go into the trades. I don't really want to go in. I think they all get addicted in there and then they die. And you know, insane thinking, but that's what's out there. So when we look at this type of stuff, it's very worrying. And when I looked at, I was trying to dig into this, and when I look at the where this data comes from, it's hard to track down. Well, a lot of it comes from Stats Canada, 2 big studies in, it was 16 or 19, I forget when. And what it said, what struck me was, if you were employed, most people who die in an opiate-related death, 75% are unemployed. Of those who are employed, to be categorized as employed, you had to earn $500 a year in the industry that you were designated. So if you earned $500 in a year and you said you worked in construction, you were considered to, you know, work in construction. So 25% of people were employed. A fifth of those were considered to be in the construction business. So 5% of people, of decedents, were potentially in the construction industry. I say that because I don't think we really know. But I know from my anecdotal process in my office that I think a lot of people become addicted, get into great difficulty, and look for casual employment in either construction or the hotel hospitality industry. And I think if we're really thinking about trying to get solutions, let's just be really sure we're examining and we know what we're talking about of who needs what and where we're directing our energies. Requests, I think just in the last week or two, we need more nasal naloxone. Naloxone is really important. Probably everybody here should know about naloxone. I always have my, well, just about always have my kit with me, but you got to pull it up, and I pulled up and injected tens of thousands of times. It's easy for me, but doing that on a cold site or out in the middle of the street. So there's requests for nasal naloxone. And the problem with naloxone, of course, now is that the power of the fentanyl or the carfentanil or whatever it is with the additional other xylazines and benzodiazepines and so forth mean that people are down a lot longer. And so anyway, we have these requests. I think they're very good. Respectfully, my concern is if kind of that's our only approach to this industry when it comes to addiction, I'm concerned about that. You heard about the study that was done. It's there. It's printed, and what came out of it for me was lots of stuff, but concern that alcohol, cannabis, cocaine, there's still significant concerns in the industry. Concerns that some people are asked to work with other people who might be impaired, about the safety culture. These kinds of things prove to be important. And in that group, remember, the sector is considered to have about 240,000 people in it. So if you're doing any research, the two things you must do in research is you must have a sample number that's big enough to represent the group you're studying. And two is you must not ask biased questions. They're the two kind of, Paul's simple world rules for research. So the number needed in this kind of sector to have a valid research would be about 300 people. And this study surveyed 639. It's the biggest study worldwide as far as we know. So a lot of useful information. How do you put all that together? How do you make plans for the future? That's why Mike McKenna gets paid the big bucks. So returning to what's been happening in addiction. As you can maybe tell from my accent, so I'm originally from Ireland, Dublin, and I spend time back and forward there, and I interact a lot with folks in Europe and Poland and Germany and Belgium and UK and so forth. The two big things that's happened in the world of addiction, for those of you who might be interested, is there is a great realization that this is not an acute disease or acute problem. It needs a chronic care model. Now, even still, in medical school and some of the residents I see, we're still locked into a bit of, this is an acute episode, we're in a merge, you've got this acute thing, and we're going to treat this, and then you're going to get better. Or we're going to dip you into 30 days of rehab, and we're just going to spin cycle you, and you're going to come out, and if you don't make it, then that's your fault. So the chronic care model is very different, right? It's how we do diabetes. It's how we do chronic disease. Again, I think it's an awareness in Canada. I just sometimes don't see it in some of the programming that I'm involved or that I come across. And then a movement from focusing on deficit-based diagnosis. You are drinking too much. You said you wouldn't drink. You are still drinking. You are this. You are drinking in the morning. You whatever. And a focus on strengths-based recovery. Now that's not Pollyanna. That's what's happening in the world outside these borders. People have, we've got the first professor of addiction recovery in the world in Leeds, Trinity University. We got the biggest masters in addiction recovery program in Dublin. We've got all kinds of stuff. We've got the Recovery Research Institute in Harvard doing all kinds of study on research, not getting stuck in addiction, but how do you get better? Not how do we tell you that you're stuck. So, I have days worth of stuff I could talk about recovery. And I thought, geez, an audience like this, an audience this size, other people must be in recovery in this audience. But I thought, how do I oversimplify this? So basically there are many people defining recovery. And one of the most commonly used is that SAMHSA, Substance Abuse Mental Health Services, something of the US. And what they say is an ongoing process of change. So it's an ongoing process of change to which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Right? There's nothing about how much you drink or how much you drug. It's that kind of concept. It's about improving global health. It's about improving social function and pro-social. That's good citizenry behavior. People who want to talk about their recovery recognize this, understand this, and want to do this. And most importantly, it's about writing one's own narrative and agency. And many people I see, especially who are really doing poorly in a socioeconomic sense, they've lost their agency. You know, other people are controlling everything. So recovery is about getting your own narrative, getting empowered, and the pursuit and maintenance of abstinence is part of most definitions, the intentional and consistent restraint of using something. But not every definition has that. So, you know, we don't get locked into that as the first step. We get into the other stuff, and often the abstinence will follow. But recovery is very possible. The other thing, if you speak to anybody about recovery or read anything about recovery, you'll come across the term recovery capital. Has anyone ever heard of the recovery capital? Awesome. So recovery capital is described by Granfield and Cloud as the quality and the quantity of internal and external resources that I can bring to bear and to initiate and sustain my recovery. And, you know, there's a lot of stuff we have, and I mean, there are amazingly resilient people who are, you know, really ill in an advanced stage of addiction. They've got amazing capacity, but horrible external resources, right? And there are some, you know, vice versa. So the key 4 headings that have been traditionally described for recovery capital: social capital, physical capital, human capital, and cultural capital. And the social capital is all about relationships. You know, in my office, when I have a WestJet pilot, a senior government official, a lawyer, a paramedic, an RCMP officer, they all want to say, Doc, I want to do this myself. I don't, you know, I really don't want anyone else involved. I want to do this myself. And yet all the literature shows that, you know, it's really complex to try and do it by yourself. Recovery is all about connection, social relationships, and it's hugely important. The physical capital, you know, have you got the property? Have you got some funding? And many times I see employers say, look, the system's not working. This is a great carpenter. We're willing to help this guy get whatever you think he needs to get and help him get back to work and be an important part of our team. The human capital and the cultural capital. And cultural capital is about, you know, social conformity and how we act within society. So recovery capital, we measure. We have a tool, I don't know, the last 10 years or so, we use this tool in the score in my office. And I'll assess someone's recovery capital. And my job is to do everything I can to help their recovery capital score improve. That's my job. Get out of the way, but try and make sure, you know, okay, we looked at this. So it formally looks at several things, and it's a really important tool from our perspective. The other thing I want to mention, and my colleague and my friend Ian will talk to you about this, there's so much overlap in what we're talking about with mental health and addiction. I just sticking on the addiction side. But Mary Leamy, psychiatrist in the UK, did a massive systematic review of 97, so not just one paper, she put 97 papers together and looked at what is it, what model of how recovery works with mental health do we know about. And there's 5 key recovery processes that need to be in place. Connectedness, connectedness, connectedness. If you're disconnected and isolated, it's really hard to be well, but it's really hard to get well with any mental illness. The hope that I'm able to meet people, not just the therapist, but meet other people who say, look, Paul, I was there. I think you can do this. I'll be around, you know. So giving me hope, a positive identity that I've changed from being alcoholic, drug addict kind of label in my head to, you know what, I'm a good person, but I got this sickness, but I think I can deal with this sickness. I got this new identity in the community. Having meaning in life and empowerment. I believe I can do this. So these things in the recovery world, these have been spoken about for decades, but not in as organized a way as Mary Leamy put it. And hugely important, this chime concept. So we think about this all the time when we're seeing people. And I just put my colleague, Dr. João from Lisbon, Portugal. You're not seeing the message I'm seeing, somebody saying hello from somewhere. And what João says is, the key, like people talk about, the Portugal model, and I don't even want to get into this discussion about, you know, decriminalization works. If you speak to João or you speak to Nuno Capes, and I mean, I was there last November, I know these people really well, there is no treatment without social integration. The Portugal model is, there is no treatment unless you incorporate and plan social integration. The government in Portugal if treatment centres will help people address and look at employment, they will fund 50% of wages of people returning to work, right, in recovery coming out of treatment. If you will take people on. The oldest therapeutic community in Europe is in Dublin. It's called Coolmine, and they have an amazing process of helping men. It's a male program, helping men come back to being work ready. And it's interesting speaking to them. It's 50 years old, but 30 years ago they said they couldn't get people jobs, but they could get them housing. Now they can't get housing in Dublin; it's so expensive. But employers know about this program, and employers want to come, and they want to speak to these men, and they want to employ them because they know that they're good men and they're good workers. Paradigm of recovery, therefore, it's just changed and grown since I've been in this field. We've moved from the expert-patient power differential, which a lot of people like, and I don't like, to a partnership. It's from deficits to strengths. It's from clinics to the community. You know, you have this problem, you must come to our clinic, and 3 weeks from now at 3:40 p.m. And it's clinic focused as opposed to the individual. So community stuff is growing up, especially in the UK and in the US and other parts of Europe. It's from individual to social emphasis, and it's from professional to peer-based. And a lot of my colleagues don't like that. They like to be in charge. They like to kind of instruct people what to do. And recovery is not about that. It's very much about peers helping peers. And it's not, let's replicate, we do the same thing all the time. Continuous innovation. You're different, everybody's different, let's talk about your situation. And then the recovery capital importance. So, in the UK, these recovery organisations are called LEROs, Lived Experience Recovery Organisations. Many of them, one of the biggest in Middlesbrough. In the United States, they're called recovery community organisations. And they grow, and they're very much community-based, grassroots, and they are really available and supportive of people who want to find some kind of early recovery and get better. And they're consistent, they're cheap, they're not relying on government programs and so forth. And ironically, they were started, of course, because it was such a secretive thing to say, I've had an addiction. So you had kind of meetings or AA meetings, and it was this closed to protect people. And what's happening in other parts of the world is recovery is actually a very good word, and it's transitioned into a movement about social inclusion and social change. And those in recovery do a lot of things in their community. They serve their communities a lot, and they're grateful, and they become a bit more louder. And there's faces and voices of recovery. There's faces and voices of recovery in Canada, but maybe not as loud as it might be. There are others, the Recovery Capital Conference, and there's a few things going on. But in the UK especially, it's about giving back to communities where the recovery organisations are. It's about helping people. It's about volunteerism, and it's about actively participating and showing that people in recovery and with mental health issues, we're not damaged goods. You can actually contribute a lot, and you can learn a lot from people. So, Faces and Voices of Recovery, collegiate recovery, universities, a lot of universities in UK, in the US, huge in the US. And in Alberta, they don't call it, what does she call it? Recovery on Campus. Professor Victoria Burns has 26 third level education facilities that they're recovery involved, people who want to look at, hey, I'm not drinking right, and I don't know about what your university years were, but mine were interesting. But how to get help. Another thing is, if I want to be sober and I want to go to university, but I'm scared about that whole, and we've had tragedies here, which I don't know all the details. So recovery on campus, 26 universities in Alberta. I don't know what we do here, I'm not sure. David Best runs a process called Recovery Inclusive Cities, where cities have sat down and said, you know what, we want to promote recovery. What can we do? We'll promote events, we'll support people, we want to hire people in recovery. Middlesbrough, London, Ghent, Gothenburg, Dublin, just all these cities who have this stamp of being a recovery inclusive city. And then we're going to talk about recovery informed workplace, because that's another key community that is grown in a lot of countries outside of ours. So recovery inclusive workplace, recovery friendly workplace, recovery ready workplace, recovery there's lots of terms used around the place, but basically what's going on is there's circumstances that could lead to or perpetuate substance misuse are minimized, while barriers to seeking help are also reduced, and people can get access to help. And in order to lessen that the stigma issue that goes on, especially with substance use disorders, the Recovery Inclusive Workplace educates its management and employees, promotes policies and so forth. This slide I actually just kind of scan yourself. It basically just says these are some of the things that a recovery inclusive workplace would be looking at. These aren't invented by me. These are, people who are trying to do this have said these are things that are important for us. But certainly promoting, encouraging recovery and honouring recovery. And funny, in the BCCSA, that research, 60% of respondents said that the workplace had been a critically important part of initiating their recovery, and 60% said it was an important place to maintain their recovery. And there was a percentage, which I forget now, said that their workplace honoured or acknowledged somebody's recovery if they were comfortable with it or celebrated milestones. So, is there any benefit for an employee in a recovery-informed workplace? Generally, it's a place that's promoting well-being, provides a sense of belonging. There is a huge opportunity to enhance integration and reintegration in that workplace. People feel less stressed if they are in a workplace that understands recovery, and they can maybe talk about it a bit openly. Decreased chance of relapse working there, and improves overall health. My son-in-law's boss, as I said to him, you seem to hire a lot of guys in recovery, and he's not in recovery himself. He says, oh, for sure. He said they're honest, they show up on time, they're not cussing and swearing in front of the homeowner. And he said, I just keep asking them, hey, anyone at those meetings you're going to that wants a job? So it's interesting. Benefits of recovery-informed workplace for the employer. This is not just about taking on a risk or being just a good citizen. It is being a good citizen, but it provides support to people who want to come back to work, who want to get some sense of pride back, some empowerment, and it is hugely, hugely important to help them with building their resilience and their determination. It helps morale of the whole workplace and reduces turnover rates. People tend to go and stick with who they're employed with. And in the UK, some employers are very proud to say, we employ people in recovery. In fact, there's a locksmith, I think, famous company, I forget where they are in England, who like to brag that they hire people who've done time for crime, burglary and so forth. So, probably a good outfit. So, what does success look like? It's cultural. It's not written on a wall, it's not a document, it's a culture. It's absolutely creating a culture that accepts and understands addiction and mental illness. And Ian's going to emphasize this. Critically important. Before people start harming themselves or others or their families, is trying to get in early. And dealing with those illnesses is still the issue that the individual has to deal with. It's not, I'm taking you on and I'm going to mind you. Right? You've got your job, you've got your recovery to look after, and I'll hold you as accountable as anybody else. But that's what success looks like, retention and recruitment. This is a document, November 2023, US, gazillions of dollars, the Biden government, 4 departments, and as only the United States can, lengthy document about recovery-ready workplaces. But they're very much about how we're going to impose recovery-ready workplaces on. I know some of these people, nice people, but my best observation is where it's more grassroots and it comes up through the organisation. But anyway, this document is there. If you're stuck for something to do, there's a few hundred pages for you to have a read of. And I'm the eternal optimist. I meet people who I think want to make a difference. I meet Mike McKenna, Louis, I meet Ian. I meet people who believe that we can do things better. And I refuse to get into sterile arguments, and there's so much negativity on the social media and in the media there are exciting times ahead potentially, I think. You've got a really, really important industry for our country, like hugely important. And mental health and related issues will be front and center in the future. People will want to work where they believe that they're respected and taken care of. And, you know, I get asked to consult and come in, and I do, and I teach and all that, but what really intrigues me is where the organization wants to develop its own energy and resources, and maybe I can help that. I don't want to be that external consultant all the time. That's just personally. So I believe there's a place for a workplace addiction recovery champion in the workplace, provides essential assistance, guidance. Confidentiality is important, but not absolute. I mean, sometimes, you know, we have to be very careful. And I think recovery-informed workplace for mental health and addiction is poised to become a cornerstone of future workplace wellness strategies. And I think that's going to allow for success for employees and organizations alike, especially in the construction sector. And I've gone over time, but I want to leave you with one slide. This is from Professor John Kelly, the Research Institute. Like, just the work that's being done outside this country in recovery it's mind-blowing. But John is an amazing guy. And I thought this slide, which I kind of stole so I couldn't change it, might make some sense to this group. And it's kind of like, if you have a house and you're sitting in it and do I smell smoke, you know, and I think it's heat coming from the other room and there's extra light and maybe there's a fire. Well, what he's saying is, too often we wait. People are sent to my office, they're so sick. Like, they are so sick. And oh yeah, we knew about it, we knew this was a problem, but we really didn't know what to do. So the house is nearly burning down, and what we do is we say, okay, well, we'll detox, we put the fire out, get the fire department and we put the fire out. And although it's hard to access detox at times, we can do that, right? The thing is, what do you do then? And he argues, he talks about, how do you prevent it reigniting? Well, you've got to get relapse prevention strategies and stuff in place to make sure that this fire doesn't take off again. And that's what relapse prevention and relapse prevention planning is. And then he says, well, architectural planning would be really important. Has anything been really damaged that's missing, that we need to put together a really good plan and write this out? And it's almost totally neglected as far as I can see. And people come through my office, it's siloed in a GP and there's an EAP and there's maybe a counsellor and there's a this and that. But there's no plan. And I say this, not as aggressive criticism. There's plenty of criticism that could come my way, but it frustrates me to see that there's no coordination. And then he said, well, if you're going to rebuild a house, you want to make sure you do it really well. So you want to get the best material. So have you got the best recovery capital? What have you got in place? What are you missing? Oh, you're missing that. Well, we better get that, right? And then his final point is, it's actually more a US thing. Because if you are convicted of a criminal offence related to drugs, you get a felony conviction and you can't get work, and it's a horrible situation. But he's saying that we don't grant rebuilding permits for people to rebuild their lives. We should be able to remove these legal and structural barriers to recovery capital, to criminal records, to allow people to grow again. So you work in this business. I don't know if anything I've said made any sense, but there's a lot of houses smouldering, there's a lot of houses on fire, and there's a lot of houses or individuals in your sector need to not have a fire, right? And I think a workplace and the power of your workplace is hugely important, as evidenced by the literature and the research in recovery, that community, and whether it's family community or work community where we spend most of our days, is hugely, hugely important. And if you want to retain your best workers, if you want to recruit, if I have a son and he says, I want to work, I'm a carpenter, I want to go work, whatever, I'm going to say, what do they do with their employees? Oh, it's funny, they do this or they have that, and they talk about recovery-informed workplace, or they do mental health stuff. I'm going to be saying, I think you should work there. So after going way over time, but I am very grateful for your attention, and we're going to have some questions later, and I'll hand it over to Ian.
I appreciate you all taking the time this morning, getting up early and doing this breakfast. I came over from Victoria last night and I spent some time walking around the city and and seeing what's going on. Just full disclosure, there's a lot of Alberta stuff I'm going to talk about, but I'm a temporary foreign worker from BC that went out to Alberta. My pre-job, before I started doing all of this stuff, was I was the Canadian director for Unite Here, which is the largest hospitality union in North America. So, you know, if you go to a camp, it's probably our guys or gals be there. I ran the camp local. I worked for the International, and I ended up trusteeing. I'm the guy that doesn't get invited to Christmas parties because I'm trusteeing most locals in the US and Canada. I'm trying to fix them up and repair things. You know, early in my career, I started as a bartender, so I think I created a lot of this problem, so it's time to clean it up on my way out. The funny thing was, back a couple of years back, I got a call. I used to always be the union guy that said, unions are great at throwing parachutes at guys and gals that already hit the ground. So, you know, 1-800-EAP, go get fixed. We'll phone the hall and get another worker. You know, that can't continue. You know, when I was leaving Alberta, coming back to my roots in Victoria, I got a call from the government of Alberta saying, I hear you're gonna have some spare time. And it was that little story about the parachute that got me in trouble and got me slowed down my retirement. I was asked if I would be able to fix the parachute problem, and that was the quote from a government person. And so we sat down, had a lunch meeting, discussed it, and the government of Alberta funded the program just to get it off the ground, just to try and come up with something. So I showed up at the recovery conference in Calgary, and with great big eyes and great big ears, just trying to figure out how we're going to fix this problem. I've worked in it for so long. I've had many colleagues, many friends, many members come to me and say they needed help. And I didn't know what to do. You know, as a leader of a labor organization in Alberta, we do A&D testing, and if the member goes out and fails, the employer usually not for rehires them, and then I, as the union leader, did the great thing, and I punished them for 35 days, took them off the board, they weren't allowed to bid. None of that was helpful, right? I'm here to say none of it was helpful. I lived it for many, many years, like all my other colleagues in the labor industry. You just grab another one, disposable employees. And we're the union. So, you know, there is a problem. The Alberta movement now is a recovery model, so a lot of stuff I'm going to talk about is going to be Alberta. I'll probably repeat myself. You'll hear a few things that came out of Paul because I respect the relationship Paul and I have. I'm very keen to listen to his words and try and put them in action and trying to amplify them in my information. So, you know, this is not only Alberta. This is BC, this is Saskatchewan, it's Manitoba, it's Missouri, it's anywhere that we have people working, and in my world, it's construction working, right? And so a little bit about the program here. Building Trades of Alberta, we're 18 skilled trades unions with approximately 60,000 members in residential, commercial, industrial construction, maintenance, and fabrication industries in the province of Alberta. The mental health of our affiliate membership is paramount in helping retain and recruit the best tradespeople available. Okay, where do we start? Let me start by saying, like I said before, we're not experts. We've lived and learned experiences, but needed to rely on evidence-based leading practices and experts in the field of mental health and wellness, like Paul here, and a number of others. We have no direct affiliation or compensation from any mental health or wellness service provider. We have been guided by research on overall mental health and well-being that is essential to productivity in the workplace. We have far too many examples to draw on that members have told us that they're struggling and we need to make a change. What I'll talk about today is what we've done in Alberta, and to begin to address the concerns we're hearing about mental health, wellness, and addiction from the perspective of the worker, but also our industry partners. The issues we are experiencing in Alberta are no different than BC. So we believe that there's value proposition for investing and prioritizing in mental health. The wellness and recovery supports are available are very important. These are additional tools in the toolbox to recruit and retain highly skilled workers to continue to advance economic growth and prosperity for replace Alberta with BC. That's where I am today, right? I mean, you're all here today because you see that the need. I mean, we're gonna pass out some little forms and things, and I'll get into it a little later on it, but there is a need, and we're not saying that this is the fix, this is the cure. This is just another tool. This is just something else hopefully you can use. We're gonna offer it to everybody in here to speak more about it later. You know, we partnered with some folks to try and get information. So my whole world has been trying to data collection, right? It's try and find out what the problems are and try and deal with it head on. And through an existing partnership we had with TELUS Health, we had access to research that they conducted through their mental health index, or MHI. That measures the mental health status of employed adults in each region of Canada compared to benchmarks that they've collected. The monitoring of fluctuations in the MHI are intended to predict cost and productivity risks to inform investment decisions in mental health support by business and government. Not surprising, some interesting trends emerged during the pandemic, and in May 2021, TELUS Health published some results of the impact of the pandemic was having on mental health and substance use since the onset of the pandemic. The point to emphasize here is, you know, basically that 25% reported that alcohol and drug use had a negative impact on their job. I used to start out by saying how many people during COVID took up that afternoon cocktail hour. You know, working from home, 5 o'clock, it's 5 o'clock somewhere. It's 5 o'clock earlier in Alberta than it is over here, so, you know. And it's true, and we get a lot of people saying, I used to call everybody liars, because I think everybody did make a change during COVID. You know, the whole onset of the isolation put people backwards, and the folks that were in recovery had a stronger thing, and as you heard from Paul saying, you know, we need community. So, you know, in 2023, the MHI identified the construction industry in Canada as having an overall mental health score of 66.1 on a 0 to 100 basis. That data is concerning, but it validates that there are high mental health risks in construction workers compared to other workers in Canada. These indicators suggest that poor mental health and wellness equals lost productivity and increased workplace injuries. Let's be honest, you know, having a union guy come up here and talk to, you know, contractors and employers about productivity, I substitute productivity with profit, right? Just change the word, it's interchangeable. Because you all know if you get a little more productivity, you make a little more money. You know, at that point, I usually see owners in the room or contractors lean in a little bit when they hear profit, and especially coming from me. But there's an ulterior motive, because as a union guy, if you don't make profit, I don't get raises, right? So it's a joint venture, trying to get the productivity on the work site up with the right people doing the right job brings more profit to the business, which in turn, through bargaining, brings more money to the worker. So everybody's going to win in that. You know, what we did in 2022 is we began collaborating with the Government of Alberta as a funding sponsor of the initiative. You know, they originally gave me funding for 2 years. Being a little Scottish, I was cheap and I invested the money and did it, you know, as best I could with what we had available. And we ended up with a little extra money at the end. So at the end, I got a call from the government, and I'd never gone through the grant system. You know, many of you may have, I don't know, but you have to have that closed down meeting at the end. And I showed up at the government office for thinking it was the end of it, right? Because this was late November of last year. And they said, we have 2 things on the agenda. How do we expand your program, and how do we extend it? And I'm thinking, shit, there goes retirement. So I committed to another year. They rounded up. They just needed a price. I gave them the quote. They agreed pretty quickly. Unfortunately, I should have given them a higher quote because they were so fast at saying sure. But here we are again. We've been extended for another year, and I'm pretty happy to say that the government's invested $1 million in this program. So we've consulted with all the BTA trade unions, the affiliates, the contractors, and even industry owners and industry partners and the big oil companies and everything. We expanded the relationship with TELUS Health and developed new relationships with experts in the field of mental health, addiction, recovery informed, recovery ready, recovery fill in the blank, workplaces. We started up a program, you know, called Building Resiliency. you'll see there's a card up in there. We put these little cards together. They're double-sided. Sorry, I didn't bring a few of them. You can get on there. It's got a little QR code on there that'll bring you to the website through the bta.ca website. You'll see Building Resiliency. You can jump on there. It's all free. It's not free. The government of Alberta paid for it. So it's all free. Feel free to use it. I'm sure your premier will be happy. Saving money. So if you go on our website, you can see the whole program. And we thought that these would be great and how to get these things out. So this was the smallest card we could get all the information on. But we ran with that. In September of 2022 at our BTA annual conference, we held a panel discussion that included industry experts from TELUS Health and Dr. McPherson from Simon Fraser University to introduce the topic of mental health and wellness and how it impacts workers in their personal life and at work. We created a microsite, which is what I just talked about, with Building Resiliency for quick access. There's 4 key areas: mental health and wellness learning, peer support program, recovery-informed workplaces, and breaking free. Building resiliency within organizations supports an individual's ability to be more adaptive, agile, and better positioned to overcome and manage disruptions and challenges over time. Essentially, workers are better equipped to manage their personal well-being and emotional stress and less likely to rely on substances in an unhealthy way. As part of our efforts of getting the word out with the Building Resiliency Program, we partnered with a large remote site operator in Alberta to distribute posters, like the one I just showed you, and postcards with QR codes, and we had stickers, we had everything. And we literally pounded their whole site. And it wasn't one. They had multiple sites in northern Alberta. They actually had, I think they may have snuck some in northern BC, one of the operator. And what it does is when you're in a camp environment with construction, and there's no privacy. So, having the camp operator agree to have stickers, and if any of you have been in camps, you know how much the camp operators hate stickers. But we made really cool stickers with QR codes. And it was just basically said, get help, right? There it is right there. So we had those stickers everywhere, especially in the bathroom stalls and the walls and the bathroom stalls and everything where you're in privacy. You can click on it because of the stigma. And we keep talking about stigma. Paul's talked about the stigma. The work stigma and the work face is really important to address. The camp operator was overjoyed to do this. They threw these things everywhere. They were all over the place. They were on posters. They were up on the walls. The other side of it. That's why everybody sees the level. And the level is something that just identifies the construction workers. I was just sitting there trying to come up with a logo or something catchy. And when we did the level, it was kind of cool because you could just, you could see not everybody's okay. And it's okay to not be okay, right? So we needed to have folks try and get the word out, know what's out there, and know what to do and how to help. Last month, we introduced a new digital service called Skills and Resiliency Microlearning. We're excited about offering this new service to help people build personal skills and take control of their mental well-being. The service is app-based learning, and it's suitable for any mobile device 24/7, 365 days a year, anytime you want it. And some of the data we did collect was a lot of folks were jumping on our Building Resiliency Program and getting on to Breaking Free, which is a little support for addiction and program at 2 in the morning, at 3 in the morning. So that's really important data to have. So if you have something that's available, that's only available at certain times, it's not going to help anybody. Don't waste your money, right? I mean, I've got some comments on some things at the end here that I'll talk about on some of the programs that are out there, and I'll try to be politically correct, and you can throw me out. You get what you pay for today. That's what you get. So the service is engaging in interactive in a gamified format to build mental fitness skills and analytics and the insight to track your own personal growth. So gamifying this program through adversity was the best thing they ever did. You get invited to come back and just do a couple minutes or just little short things. There's a card stock on your table, I think was handed out. All right, go again. With a toolbox talk, and this little program here. If you jump on the QR code, spoiler alert, at the bottom, if you use that secret code that I had printed on paper, feel free to go ahead and sign up for the program and test it out. The results from adversity indicate that after using the skills and resiliency microlearning, 92% of learners felt that they were motivated to act positively, and 86% saw an impact in leader engagement, and 81% found improved company culture. The card I was just talking about is on the screen right now. The example of the new service offering is the Toolbox Talks. How many of you have been stuck on what topic to talk about at a toolbox? I don't know, you guys are doing toolboxes before the shift start, and I gotta be honest, if there's safety folks in here, you guys, and you still have hair, I don't know how you still have hair trying to figure out what the hell to talk about today. The best safety talk I ever went to was actually, I have to take credit for it, it was one of my guys up in the culinary industry, and he jumped up and the boss put him on the spot and told him he had to do the toolbox talk today, so he got up and he went in a great big, really hard to understand, English was his second language, he said, what's hot is hot, what's cold is cold, don't mix them up. Right? Back to work. And it got the same reaction, but I've been repeating it for about 5 years, because I think it was one of the greatest talks because it's there. This one that's in front of you on psychological safety, Adversity's contracted Mike Holmes. Don't even go there about the comments about Mike Holmes, the home builder. But he describes in his own words, in his own voice, in 5 minutes, what a psychologically safe workplace is. And when I heard that through this adversity program, I had a different feeling for Mike Holmes. He summed it up in 5 minutes, and it's basically just it basically talks about how you can create that psychological safe workplace, because people are living the lie in our industry, in the construction industry. Everybody lives the lie. How you doing today? I must have said it 3 times today. Living my best life, living the dream, all this stuff. Bullshit. I was, because I rode my motorcycle here, so I was living the dream yesterday, right? But today, I was driving here and almost got run over twice, so I'm not living my best life. So it's really a complicated thing. And when we had an opportunity a week ago, I was talking to the Association of Maintenance Contractors of Canada, and I needed to talk about something, and I wanted to do the same thing that Mike Holmes kind of did. So I went to the adversity folks and I said, I need a psychological safe toolbox that I can do, that I don't have to do online, that I can do on paper. And within about 5 days, don't ever make them do it again, they said, but within 5 days they had that document in front of you. So if you have a specific issue in a big site or a worry or any of that, we can tailor make a toolbox for you. And the neat thing about the toolboxes is they're meant to be quick and interactive and contribute to team building. Today's purpose is on paper, but in practice, you would conduct your toolbox talks through a team in an application that's connected to all your workers using their personal email addresses and smartphones, or yours if you're giving them to them, right? That was the neat thing about this, is that everybody gets invited to a team building off of adversity. You'll see if you apply, if you sign up and do it all, you'll see a solo, which is just personal. You'll see a team, which is a team building. You can call a toolbox. It actually sends messages out to everybody when to get on, what to do. You all get on this thing and you walk through the program, and it's a recorded program that's done for team building. So all your toolboxes, and ideally, you've got some folks that are out in the field. They want to have the same toolbox. You're all on the same page. You can just keep running it through. The digital team environment allows you to conduct interactive toolbox talks and increase engagement and build mental fitness skills. There's many sample toolboxes to choose from and improve personal health and well-being and reduce the stigma associated with mental health and wellness. There's also an opportunity to customize toolbox, which I spoke about earlier. We may be about a month and a half into this thing with these guys at Adversity, but they are really helping us out a lot. I mean, we found the folks that we've got using it signed up. It's like the gamified stuff. You're getting scored, man. Like, everybody likes that. You want to make sure you're getting better. But I'm going to be blunt and to the point and say, if you go on the page and you sign up and you use the BTA build, sign in and be truthful. You got to be 100%, right? You all heard it 100 times. I'm not gonna, we're all adults here. It's shit in, shit out. That's what it is. If you don't put the right stuff in, the truth about yourself, you won't be able to judge where you're at. And the whole thing is to get the goal, it's the capital. How are you getting capital? How are you seeing your recovery capital, right, in anything? We've trained, our next thing we did was becoming a peer support. So Paul talked a bit about it, a peer champion or a support champion, recovery champion. We call them peer supports. We've trained over 70 of them to date with tremendous engagement from BTA trade members as well as contractors in Alberta. I'm really overwhelmed by the number of contractors that have taken this. We partnered up with a few groups, and they got involved. So we have Edmonton Exchanger, Worley, Bantrell, PCL, Genesee, Malloy, Laird, Aptums, Alliance, CAM, Rotaflow, Aluma, Safway, Stuart Olson, Wayward, Park de Rocher, Civio, Scorpio, Masonry, and the BAC. And I mention those is because, part of this whole thing is what Paul said, how do we advertise? How do we put a sticker out there to say that these people are recovery-informed workplaces, right? If we don't advertise them, if we don't be able to promote them, why would you do it, right? I'm talking to the contractors in the room. Why would you invest in this if you're not getting anything out of it? You will get more out of it, and maybe those few tradespeople that are unemployed that are looking for work have a choice of 2 or 3. They have many choices because no one can find any labor. So maybe they get to go to the right place. They get to go to the one that's trained, right, and taken it. So the peer supports were trained through a workplace mental health leadership certificate program, which is one of a kind in Canada. We've designed it, and it's a partnership between TELUS Health, Bell Canada Mental Health, Anti-Stigma Research Chair, and Faculty of Health Sciences at Queen's University. The accredited certificate program is delivered virtually and consists of a full day of instructor-led workshops along with 3 e-learning modules and 3 online exams. And just think, you can all call your moms and say you graduated from Queen's if you take this thing, right? So you get a cute little certificate, and it's not an easy program. The one day we did was because everybody's busy. So it's a real crunch on the one full day of instruction-led. And then you've got to do some other stuff on your own time, and you get an opportunity to run through. Our whole design of that program was to not put doctors in the field. It was to put people in the field that could assist, that could help. Like Paul said, they're kind of like the cruise director. Some of you operate on unionized work sites. The first person you get on the site is usually a job steward. The second should be someone with peer support training. And it's not just for the mental health and addiction purposes of the worker, because it might be Sally, the crane operator, whose partner is having a struggle. And I'm sorry, but I want Sally's head in the game every day with loads over everybody's heads. So whatever it needs, so a peer support person they can go to, and they can talk it out, figure stuff out, and figure out whether they need time. Go up to the employer, say, look, Sally needs a few days off to get their partner, in some treatment or in some assistance or that kind of thing. Our program of building resiliencies is not just for the worker, it's for the family. So that's the spouse, the partner, or the kids. Sometimes it's your kid. Sometimes it's your spouse. Sometimes it's you. So, being able to have someone on site that can give you that assistance, not with a cure, but giving you the answers or finding the answers for you, just like a job steward would do on a warning letter or a labor dispute, right? So our whole thing today on this is the peer is important. Having coworkers that recognize that you recognize and they recognize you in recovery. Like the safe supply and the harm reduction model is one model that BC's doing. In Alberta, they're doing the recovery model. Anybody see the lines here? They're each doing one model. There is room in both provinces for both models, right? And we need to do it. We just had the recovery conference. Unfortunately, Paul ducked out, got a new hip while I was on. I was really, really impressed to see that, the Alberta government, whatever your personal feelings or whatever it is, they are really pushing hard on this recovery model, and they opened up the recovery conference. There was over 2,000 folks in attendance. And unfortunately, I didn't see many from British Columbia, from the government of British Columbia, but I met with the government of Manitoba, the government of Saskatchewan, government of Nova Scotia, government of Ontario. I know I always meet people from BC there, from government agencies and that, but the role of being able to meet those folks, never saw them, right? So, and I think that all governments have to look at all other governments, what they're doing, right, wrong, or indifferent. There's a recognition. There are people that are using in Alberta that have no recognition, because it's a recovery province. I'm gonna say it, there's people in recovery in British Columbia that get no recognition because it's a harm reduction, safe supply province. And that's the stigma that's out there, and that is the thought. I mean, we have a lot of Albertans that are you know, studying for those tests, that come to work in BC because they can't get through our drug and alcohol at the start. That's a problem. We don't want to send those people out of a province to work. We want to have people working within the province. We want to bring people back. You know, Paul mentioned the optics. You know, young families and kids, and you know, the trades are an amazing opportunity for kids. I'm not knocking the folks that want to be professional students for 4 or 5, 6, 7 years, but at the end of the day, you know, getting paid to learn a trade or to be educated is the way to go. And I mean, there are families I've spoken to that are nervous about letting their kids get in the trades because of that optics of, oh, they're going to be in the construction industry, they're going to be addicted, and they're going to die. You know, that's not what it is, but that's the optics that we have out there. You know, over the course of the 3 modules that we do with this training, the peer supports explore the ever-expanding business case for mental health and in the workplace. This includes the improved understanding of relevant legal, ethical, and business concerns. This certificate program also supports the development of empathetic and solution-focused leadership skills. Like I said, you know, Mike was quite interested in this, and Louis, and you know, they really are investing a lot with the survey and all the stuff, and hopefully we can maybe do something with that with you guys, with the peer program, and do something that's designed just for BC. The policy framework for recovery-informed workplace. I mean, last year we began introducing the concept of recovery-informed workplaces. We firmly believe that we need to be part of the solution for creating a workplace environment which proactively destigmatizes addiction and mental health. See, I said addiction first, so I didn't leave it behind. Since introducing the concept of recovery-informed workplaces, we're turning our attention to how we can support our partners putting a concept into practice. From our perspective, we need to consider factors that may present barriers in realizing the recovery-informed workplace. We have identified 6 components for consideration. Shared commitments and expectations should be defined in a policy framework that can be measured, monitored, and reported on. The policy should recognize fundamental principles such as the protection of workers and the public against safety risks. The construction sector has a commitment to the Canadian model for providing a safe workplace and alcohol and drug work rules. We intend to advocate for further consultation and changes to the Canadian model to align with the recovery-informed perspective and approach to supporting workers, contractors, and industry owners. Ironically on that, I held a recovery-informed workshop for about 22 employers out in Alberta, and I didn't say it, they said it. They were the ones that were talking about how the Canadian model needs to change. 90% of the time you hear the unions saying the Canadian model sucks and it has to change. Having a room full of contractors say the Canadian model needs to change, little light bulb out. You know, we need to bring it to today's standard of how we're operating, how we're dealing with people on the site. As part of the shared commitment, emphasis should be on supportive workplace culture that accepts and respects the dignity of workers and assists those workers who are pursuing or are in recovery. Proactive education and awareness is important to reducing the stigma around addiction and mental illness. With the introduction of the new interactive services through skills and resiliency training, we're hopeful that our approach will begin to make some inroads in proactively raising awareness and reducing that stigma. Peer supports or mental health champions will encourage a work environment that is safer for people to speak up, share ideas, and reduce stigma. I keep saying the word stigma because it's a huge issue here, right? Recovery coaches is the next step. We think to be a more robust and supportive workplace. The jury's still out what the recovery coaches are going to do, opposed to what the peers are going to do. Early detection and prevention is critical, encouraging self-disclosure and the ability for workers to ask for help without repercussions. There should be a range of support that are non-judgmental and non-punitive. That's important. People live the lie because they can't get caught. And the studies have shown, and we have some folks from, that do all this studying, and we don't ever expose what they say, but the studies are showing that people will lose their family, they'll lose their relationship, they'll lose their four-wheelers and their cars, and they'll keep on doing and keep on using. But when they lose their job, they're done. That's the end of the game, is when they lose their job, that's everything. So it's really important that that we support folks, and the recovery support needs to be available for those workers that test non-negative and drug and alcohol testing and are subject to further substance use assessments and diagnostic training. Accountability is a huge thing. It's important to all workers, including management, to be held accountable and responsible for engaging in a supportive and non-judgmental work environment. We all know that there are many economic benefits to creating a recovery-informed workplace. Increased worker recruitment and retention is a high priority for all the industries are struggling to address skill shortages. We can't continue to do what we've done in the past and expect a different result. We need to amplify our approach to recruitment and retention. And there's a huge group of folks in recovery that won't go back to work because that's where they got sick, or that's where they're not feeling supported, or whatever. And now they're going to flip burgers instead of welding stuff that they, at a big site. We need to get them back into the trade they learned, they love, and you're going to do that through support. We also know that when workers feel supported and take pride in their work, that there's a healthier and safer work environment and the reduction of workplace injuries. You see where I'm going with this? It saves you money when you have less injuries, right? It saves, your scores get better. Everything works as with the mental health. Positive well-being, healthier and safer work environments, and reduced workplace injuries all lead to greater workplace productivity. Greater workplace productivity benefits everybody, workers and their families, contractors, industry owners. The long-term goal of building resiliency would be for workers to recognize workplaces that are certified in recovery-informed workplaces that recognize those workers, and it would serve as a critical recruitment tool. You can tag it on, like Paul said, if he's talking to his son-in-law and saying, oh, that company looks after their workers, that's where you want them to work. That's where you want them to stay working, right? That's where they feel comfortable, that's where they'll work. Again, I've been telling you all about the stuff we've been doing in Alberta. It applies to anywhere, anytime. Like I said, I'd rather be doing this in my home province. I'm doing it in my later years in another province, but I would sure like to see this kind of program align with the program that's already in play with the government. Like there's plenty of room, there's lots of elbow room for two models here. And it doesn't take a lot to do this. It's already the ground rules, everything's been set, everything's been done. Compliments of Danielle and the gang next door. They picked up the tab. There's just so much opportunity, and meeting with the folks like Paul and all the folks right across the country on this. It all comes down to some little bartender from Victoria that just wanted to try and fix all the shit he created when he started pouring drinks for everybody. I should have a recovery home. I know most of those people. So at the end of the day, nothing differs between provinces. Everybody's just trying to look after the worker and trying to look after the contractor. This whole thing tries to look after all parties. The family unit, the contractor unit, the owner unit. Everybody's got to be safer, everybody's got to be happier, and everybody's got to care about what they do. And judging you all coming here at 7 o'clock in the morning, you all care what you do. So I will end it with a quick, I hate to say quick story, but a story of a young welder in Alberta that was in recovery, 26 years old, got dispatched to a job on the border between Alberta and Saskatchewan, and he had the world by the ass now. He'd been, he'd had the greatest job, the greatest trade. He was an alloy welder. He was doing, making money hand over fist, and he got into some difficulties with his mental health and started treating it himself. And then he got cleaned up. He got into recovery. He was doing really well, and he finally decided he was going back to work. He worked at a couple places, and then this gravy job came, and he took off and he went to work. And he showed up, and within a couple of weeks of being on the site, he realized there was more drug and alcohol issues on that site than there was where he got originally addicted. So he went to his foreman and he said, man, I got to get out of here. You got to give me a layoff. I can't do this. I can't be here. It's bad for my recovery. The foreman said, if you want to lay off, it's quit, and you'll never work for us again. And I'll send a slip to the hall. So he took that, head down, ass up, went to work, phoned the hall. A couple days later, he said, I can't be here. I need another dispatch. I need to take a layoff, and the foreman won't let me. And the hall told him that if he left the job, he wouldn't be dispatched again out of that hall. Because they needed him on the job. They didn't have anybody to replace him. So 51 days from the start of Logan's career at this workplace, he was found dead of an overdose. And dealing with the family was a pretty tough thing for me to have to deal with, to talk to them, to tell them that the foreman did nothing wrong and the union did nothing wrong. They didn't know what was right. They didn't know how to react and how to treat Logan and how to respect Logan in his recovery. The foreman needed the job finished. They didn't have another guy. It would have put him behind, so he did the right thing. He put a little muscle in there to keep everybody working. We've all done it. I suspended guys for 35 days for testing positive, right? That was my muscle on them. Don't do it again or you won't be on the board for 35 days. Logan got done. The hall didn't have another welder to dispatch. Did nothing wrong. They didn't know what was right. So, we lost a good kid, and hopefully this program stops the Logans, right? So, and I spent a lot of time with his parents, being able to say his name, because he has a name. He was a real person, and hopefully it just tells you, we're not here to chastise, we're not here to do it. What you've been doing has got you to here. You all showed up. Hopefully you can take some of this stuff and recognize that we need to we need to recognize recovery as well. Right? Thanks for your attention. Appreciate it.